Hi, my name is Sam Kolovson, and I'm a PhD candidate in Human-Centered Design and Engineering at the University of Washington. Today, I will be presenting my work in collaboration with a smattering of wonderful collaborators in Psychiatry and Behavioral Sciences Creative Lab at UW. Consider for the next 5 minutes that you are a researcher attempting to conduct a large-scale clinical study on depression. Your study is 12 weeks long and will be delivered via a mobile app. Additionally, your study will collect both active and passive data. As with any research project, one of your biggest challenges is getting good data. In past studies that you have done, you've been able to recruit the large sample size that you wanted, but most of your participants dropped out after the first week or two. And you are not alone. Previous studies by my research team and a majority of similar studies retained less than 10% of their sample. This is where our work comes in. We sat down for a 90-minute interview with 20 would-be participants in a study like yours and ours. We asked them to respond to probes to check their understanding of passive data and their concerns about data privacy. And we asked for their feedback on possible designs for a mobile app that we described as being developed for exactly the study that you are running. Here are the main things we took away from those interviews that we recommend researchers like you and ourselves take into account when designing their long-term remote mental health studies. First, design the remote study and digital health app to balance participant burdens with the research goals. Second, support engagement by providing feedback on study data. And third, develop an educational consent process for passive data collection. The first takeaway for designing your long-term remote study with a depressed cohort is to balance research needs with participants' needs. For example, you might be excited about collecting voice data because it can be a biomarker for depression. However, we found voice-based assessments were viewed as burdensome. One participant described the cognitive burden of using their voice instead of typing. I feel just a little bit more effort to say it out loud. You have to really know what you're saying, and you have to be concise and say it all at once. But when you're typing, you can take time and pause and delete things, and you don't have to fully start over if you mess up. So, if you need voice data for a study, consider making voice-based assessments infrequent or giving participants flexibility about when they can complete these assessments, and/or informing participants about the research need for these data. The second takeaway is to support engagement through feedback. Feedback may be important for keeping participants engaged because they might feel they are getting something out of what they are putting in. Furthermore, feedback was expected, so deciding not to provide feedback could be detrimental to your study. As one participant said, I assumed that they were going to take the data, analyze, and then kind of give me feedback on, oh, we noticed that when you do this, your mood drops. I assumed that was going to be part of this app. That's my expectations if I was going to do this study. From the researcher's perspective, however, feedback could conflict with study goals or have unintended consequences. Therefore, feedback would need to be designed well and thus warrants further study on its own. The third takeaway is that for introducing your participants to passive sensing, information is not education. Just because you explain to the participant during the consent process what data you need to collect does not mean that they fully understand it, and especially understand the risks that it may pose to them. Almost all of our participants said that they were willing to share their passive data with researchers, but we also found that our designs were insufficient to ensure participants were fully aware of what they were consenting to. We suggest that researchers should focus on developing and testing an educational consent process that goes over each type of data being collected and why it's needed for the research, for both during recruitment and during onboarding of the digital health app. In summary, if you are a researcher designing a remote study for a depressed cohort, we suggest considering how to keep burdens on participants low while still meeting your research needs, how to provide participants with feedback to keep them engaged, and how to ensure that participants understand what data your study will collect, why you need it, and the consequences of collecting that data before they enroll in the study. Though taking these suggestions into consideration will not punch you a ticket for 100% retention rate, ignoring the participants' need is likely to be detrimental to your study. As one of our participants put it, I constantly need something to remind me why I'm doing this study. I started this. Why am I going to continue doing this? I don't care if I quit, I'll feel the same. That's the biggest hurdle. Why should I keep doing this when I don't feel anything? Thank you for listening. I'd like to thank my collaborators, Abhi, Jaden, Ryan, Sean, and Pat. Please check out our paper, and I'm happy to answer any questions during the conference, or my contact information is on the slide.